Hi, I'm Lourah Kelly, and I'd like to thank my co-authors, Nancy Hu, Samantha Hersh, Jessica Flori, Lauren Lewis, and Kristen Zajac, for their collaboration on our poster, Suicide Risk Among Adults in Recovery and with Substance Use Disorder in a National Sample. Our funders include NIAAA, which funds CHEARR, the Collaborative Hub of Emerging Adult Recovery Research, NIMH, which funds CAPES, the Center for Accelerating Practices to End Suicide, and NIAAA, which funds my K99 ROO Pathway to Independence Award. And I'm also an assistant professor at UMass Chan Medical School. So meta-analyses show that individuals with substance use disorders have greater risk of suicidal thoughts, attempt, and mortality than folks without substance use disorders. Less is known about recovery. We think recovery might impart lower suicide risk. So some work that we've done suggests that folks with suicidal ideation not in the past year, so that has been resolved, those folks actually bear better in substance use treatment with contingency management. So our idea is that folks in recovery may have fostered some resilience from suicide risk. So our main research question is, do people in recovery have lower suicide risk than people not in recovery? These data are publicly available from the National Survey of Drug Use and Health from 2021. Only adults answer questions about recovery, so this sample focuses on all adults 18 and over. We have some self-report measures, and our data analysis includes chi-squares and multinomial logistic regressions. So the regressions show that individuals with substance use disorder and in recovery have similarly higher odds of suicidal thoughts and plans than persons not in recovery and who do not have substance use disorder in the past year. People in recovery also had higher odds of suicide attempt than those with substance use disorder in the past year, who were also then higher than folks without substance use disorder and who were also not in recovery. So figure 1 shows the actual rates of suicidal thoughts, plans, and attempts among these 3 groups. Another way to conceptualize this is that rates of substance use disorder and recovery are higher among people with suicidal thoughts, plans, and attempts. So if 8% of the general population is in recovery, we'd expect 8% of the population of folks with suicidal thoughts, plans, and attempts to also be in recovery. But that's unfortunately not what we see. Rates of recovery are double or triple among persons with suicidal thoughts, plans, and attempts. So unfortunately, recovery does not seem to be protective against suicide risk. People with substance use disorder and those in recovery have higher odds of suicidal thoughts, plans, and attempts than those without substance use disorder and not in recovery. We think that trauma from addiction or other shared risk factors like impulsivity and mental health conditions may heighten suicide risk among those in recovery. So recovery supports and services then should include management of heightened suicide risk and foster coping skills for potential ongoing or chronic suicidal thoughts or behaviors.